what does your gut tell you as these folks leave today? Should they be walking out of here thinking, oh my God, or should they be thinking, hey, you know, we're going to figure this out. This is going to work. May take stages or changes, but what does your gut say? Joanne?
Okay, I'll start. I think that depends. And it depends on what your definition of success is. So can we work hard to get people enrolled in coverage? I think we can, and I think we will. Will people find coverage affordable and maintain their premiums over time? A concern, but I know there are lots of people working on it. I know insurers are working to try to find ways to help make it easier for people to pay their premiums. So I think if we can do all of that, then we maybe can reduce the number of uninsured in our state. Even though we already have a low level, we can reduce it further and improve in that way. Even if that's all good, I think one thing long-term we should think about, we should all be thinking about, is the subsidies that are funded by the federal government. And I think people forget that that will be a cost to the federal government. And so as those subsidies increase over time, what will that do to the federal budget? So just something for us long-term to make sure we're thinking about. Overall, I think we want to measure success by reducing healthcare costs, right? So, and I think we all have a role in that. Providers are continuing to do what they can to become more efficient. The ACA has some new demonstration projects, and we know several of our providers are taking advantage of those, and we're doing some of those kinds of things even before healthcare reform was enacted. So working to become more efficient, working to, and I guess one thing I'll point out is we have is that it's not just providers, that it is employers working with their employees, it's us as consumers doing what we can to make sure that we're improving our health and using healthcare costs more efficiently. So I think it depends on your measure of success, and I think we'll see when the dust settles over the next 5 or 10 years.
Now your members will see a lot fewer uninsured patients in theory, right?
Potentially, yes.
So is your thumb up, down, sideways, to the wind, or
I think if we're seeing fewer uninsured, that means less uncompensated care, and I think for businesses that means reduced cost shifting, and so I think that's a very positive.
Okay, Mike, what's your gut tell you?
I think it's all about your expectations and the time horizon. But over time, our system will get better, both what's available through the federal marketplace and the systems used to enroll people, along with the way we're able to operate within the private marketplace. It will get better. Last week was also in there are things called regional enrollment networks that are formed with brokers, carriers, healthcare providers, social service agencies, all coming together. There's 11 of them throughout the state of Wisconsin, focusing on their particular geographic area where the healthcare systems are relatively intact, the agency broker networks are relatively intact, employers, et cetera, and really looking for a way to how not only do we deal with the immediate need of transferring the 96,000 plus Badger Care folks and the 24,000 or 25,000 Hearst members into other coverage, but also the 400 to 500,000 uninsured, and then the rest of the population. And there is a sincere desire, because we all have the same objective, not unlike what Steve said at the beginning. What are we here to do? We're here to serve our customer, and the customer is you, whether it's individuals or as employers. That's what our role is, and we're not performing our role adequately if we're not helping you find the best benefits possible for you as an employer or as an individual. And I'm very impressed with the amount of energy and the sincerity of a very diverse group of organizations trying to make that happen. So long term, I think we're going to have lower level of uninsured in the state of Wisconsin.
Great. Kelly?
Right. Well, I have to say, I love how Joanne framed the issue of it depends on your definition of success. From the employer perspective, I think some of the components of success are, providing maximum benefit, if you're going to be providing a benefit, for the best cost possible, and avoiding exposure to penalties, fees, violations, especially the ones that you can't predict and you don't see coming. If it's part of your strategy, that's another issue. What I kind of predict happening is that norms will be evolving as far as what types of employers offer what type of benefit package by industry. I think it's going to be very different on a case-by-case basis depending on the type of business, also impacted by demographics. And I think that over time there will be some certainty or norms that coalesce for different industries, such that even the associated types of trade groups and professional groups may be additional resources in the future to help their members know what is common in certain fields. I want to go back very quickly to the question from the reader who was a restaurant owner. I think I forgot to answer the last and probably most important part of his question, which was, should I play or pay? And again, it's a hard one to answer because there is no one-size-fits-all answer to that question. It takes a pretty detailed review of your own facts and circumstances. But I can tell you that what I see in the restaurant industry is a lot of cutting back hours so that employees are not going to be eligible for the full-time coverage and therefore can't trigger a penalty for the employer. That may be common in the restaurant industry. In the retail industry, I know employers, a lot of them are used to having some of their employees on Badger Care, and that's been something comfortable for them. Now, 96,000 people aren't going to be on that, and so that's going to take some assessment. Other industries, I'm sure it's going to be much more normal to have X, Y, or Z type of benefits practice. So I do think it is going to settle out. It is scary. I think we're all going to pull through and figure it out.
Carrie?
Yeah, Kelly kind of touched on it. I was going to kind of summarize too, is that I think this pay or play issue is not an issue for some industries. Like I have a large manufacturing clients. They're going to continue to offer insurance, at least in the short term. It's very affordable for their employees. They have very few penalty situations and they'll just deal with it. But some of the industries that Kelly mentioned, like restaurant, retail, home health care, convenience store, some of those industries, just in those businesses, do not offer health insurance at all, or they offer it to very few people in the organization. They offer it to the admin or the higher level full-time office people, and that is where I think that this law is detrimental to them because they don't have a bottom line for which to offer health insurance or have the penalty. And I don't quite honestly know how those industries are going to deal with this because this is huge, huge dollars. It's different if you're a successful large manufacturer or a large successful company and you're already offering insurance. The pay or play decision is a different decision, but if I have to decide what's best for my company, do I offer insurance or do I take the penalty on all these employees? Well, that's bottom line that now you don't have if you even have any to begin with. And yeah, unfortunately, this 30-hour-a-week thing, this is how some industries are going to control their penalty is by putting people at 30 hours a week or less. I mean, heck, the Green Bay Packers, when Lambeau Field, there was an ad in the Sheboygan Press for jobs a couple of weeks ago, months ago, whatever, part-time, under 30 hours. Well, obviously, they don't want to offer health care. So it's an unintended consequence, but that's what the rule is, and that's what the law is, and that's what people are going to do. They're going to use the law to help their situation. And small employers are going to have the shock of the premiums, but I think that maybe can be managed, and to some extent. And we do have the credits, and we do have the exchanges. And in 5 years from now, our discussion on this whole topic will be completely different. I don't know if it'll be better or worse, but it'll be different.
Jeff, is this going to work?
Will it work? Well, I guess I would preface that with, I think we would all recognize that the current healthcare system that we're in right now and the one that we've been accustomed to forever is not perfect. It definitely has some problems. There are a lot of challenges. Wisconsin has done a fantastic job of mitigating some of those overarching challenges by having programs in place and safety nets to take care of many of the access issues, because our uninsured population is less than others, but there still are issues. It needed some fixing. Whether or not the Affordable Care Act is the answer, I think remains to be determined. But what I believe it will do, currently there's 50 million uninsured people across the country. That's a problem that needs to be addressed. And I believe that the Affordable Care Act will do a nice job of addressing access to health insurance. I mean, people will have access to health insurance. The key to it is going to be the question around affordability. That first letter A in the acronym, how are we going to handle that? Because everyone will have access to health care. There will be a lot of options out there. There are premium subsidies, substantial, available for people with lower income levels. My question is the affordability of that. How do we continue to afford those subsidies over time? So I believe this thing really will evolve significantly. I think in 5 years we'll look back on it and it will be a lot different than what it is today. So I can't predict whether it'll work or not, but it does fix some of the issues that we had. It's, I believe, going to do so at a price tag that's going to be difficult to account for, and we'll see kind of what changes help mitigate that down the road.
All right, stay tuned.